Now, what we have to understand about that is they had laws, once again, to deal with, how about all these babies running around, that half, with the master's children and all that. You know how they had to make us 3/5 human or 5/5, whatever they did, and we weren't all human, right? And what do you do with all these, quote, mulattoes? You know what a mulatto is. And it's interesting because the mulatto comes from the word mulus, which is where you get the word mule. And a mule, of course, is the offspring of a jackass and a horse, which means that you have a different species. So people that call him mulatto really confuse me. Call themselves mulatto. You're calling yourself a mule. But that's what they say. I am, so I must be what I am. Right? So you're looking at this whole notion. How do we square this up? And why? What happened when all of these masters, all these white men would go out to the barn with the woman and all that? What happened? Why did they have to square in court how much made a person black and how much made them white? Why did that become an issue? Only one reason: inheritance. Who's going to have the right to inheritance? They can't have the right to inheritance. It's the object. Okay? It's always about that. So now I had to start taking a look at certain behaviors of African Americans, particularly, of course, my focus was African American males. Now we know that those who have the highest homicide rate is who? African American males have the highest homicide rate. Okay? Who has the highest suicide rate? That's right. So European males have the highest suicide rate. Now I think that's interesting. That's an interesting statistic. Now let me explain to you what that means clinically. If you come into me, now first of all, tell me what depression looks like, because usually people that commit suicide are what? They depressed. They ain't happy about something. Matter of fact, they ain't happy about a lot. So they ain't happy. How does that look? How does depression look? They have the little things on television commercials that let you know what it look like. They're sad. They're sad. They lost of appetite. Withdrawn. People start giving stuff away, right? They do all that kind of stuff. They get teary. They sleep a lot. Well, okay, you got all the symptoms. That's a depressed person. They come into therapy. You got to work with them, right? You got to try to help them. That's interesting because we try to help that person because we want them to want to do what? To live. We want them to want to live. And there are all of these therapies around it. So now you got a person that's homicidal. He comes into therapy. Now, why would a person be homicidal? They look at him and they go, well, they're antisocial personality. People have behavior, they act out, they're compulsive behavior. They're eventually labeled a sociopath. Guess what? You can't cure a sociopath. They ain't curable. So what can you do with them? You lock them up. That's real simple. The prisons is a system that's working. It's a growing, booming business, and we got the folks we need to put in there. Because they're sociopaths. You can't cure them. You can't fix them, so you just put them in an institution. And the moment they go into therapy, they get with the white therapist, they go, he's a homicide. Okay, gotta go. Straight to the institution. Whereas other youth who have the other behaviors, they don't have to go to institutions. They first go to treatment facilities where everybody try to help them. But the black one with the same symptomology goes to a corrective institution. Got the statistics on it. Carl Bell looked at it and said, this is what they do to these children. Okay, now, I want you to look real closely at this, and I'm going to use your example. An example that I actually used it before I even been to Brooklyn. I never was in Brooklyn. But since I've been in Brooklyn, it has a whole lot more meaning to me when I use this example. What do you call an African-American male, between 22 and 25, decides to go to a bar frequented by off-duty police officers, takes with him his gun, and starts a brawl? What do you call that? I call that suicide. That's what I call that, suicide. But it doesn't look like sad, teary, weepy, can't sleep, write the note and blow my brains out. It doesn't look like that. Because you see, we have something called invited suicide. I'm going to invite it. Because you see, I can't go out like a punk. I got to go out large. I'm going out large because I ain't going out like a punk. I ain't going to be in a back room somewhere whining and crying and pulling a trigger. I'm not going to do that. It's not culturally acceptable. But you know what? I'm depressed. It's called an active depression.
Yeah, go into that.
Okay, it's an active depression, which means it doesn't look like the depression that's in the DSM. So now when I come in, tell me how different you're going to treat me if you think my diagnosis is depression versus sociopath. It's depression versus antisocial. That's not what you're looking at. It's not a homicidal person. It's a suicidal person. Case in point, in my community, we have what is called a Portland House of Emoji. I work with Emoji for a number of years. It's a residential program for kids who are gang involved, whatever, gang affiliated, want to be a gang, all of that, whatever it is. Because I always wonder how they can even say gang affiliated, gang associated. Your brother is in a gang. Does that mean you're gang associated, gang affiliated? What does that mean? That's my brother. You know, they don't even know, well, we got to put him in some kind of label. I said, well, he lives with him. What are you going to do? You think when people want to hurt him, he's going to ignore it because he doesn't want to be in the gang? You know, he's going to help his brother. So, you know, they don't know because they always got to put people in a box because you got to do what to them? Measure them. Right. So they didn't know where to put them. We call that family. I don't know. So now we have this active depression. So now we're misdiagnosing the whole thing. These two brothers that I know that run the House of Moja, they're two identical twins. They served time in prison. They're both in recovery. Both of their names is Johnny. They're identical twins. Both of them named Johnny. Go figure. I don't know. Daddy must have liked the name. So what happens with them is they both run that Portland House of Moja. So they decided just so you could just differentiate. One's called Biggie. They call one Biggie. Biggie and Scotchy. That's how you do it. So now Biggie is in front of one of the local black high schools. And there's a fight that breaks out. These two young brothers are out in front of the school. One is 19, one is 16. The one that's 19 has pulled the gun on the one that's 16. You know, the crowd thins out. Johnny's there going, look, you know, he is preaching. Look, you know, brothers, we don't want to do this. You don't want to do this. This is, we can't keep killing. You know, he's going through the whole thing and I ain't even looking at him. Guy hits the gun, points it, pulls the trigger and it jams. The gun jams. Which is, in my sense, the time to run from the heavens of saying, go, run. We spared you, right? The kid stands there, throws his hands back like this, right? Just stands there. So the guy hits the gun again, pulls the trigger, and it jams the second time. Guy starts laughing, kind of chuckling. The 16-year-old's chuckling. Hits it again. This actually goes on. Third time, it jams. He says, listen, brother, you think I'm afraid to die? 16 years old. He said, I'm not afraid to die, brother. I'm afraid to live, is what he said to him. He hit it the fourth time and it went off. And what I understand about that is I have to get into the psyche of a 16-year-old boy and say, why is it, how could it be that at 16 he no longer wants to live? He can't see a place in the world for himself. And I'll tell you why. Because we're a man-object-oriented system which says that you are what you are based on what you have. You are measured by your things. That's why you have brothers walking around, don't have a home, don't have a car, but got 50 gold chains. Because I got to wear some worth because I don't have any worth.
Right.
So when you begin to look at those things, you say, now you're telling me I got to measure myself by the thing, and then you tell me I can't have them. You bar every way that I have to get the thing, and you tell me I'm nobody if I don't have it. That's what our society does to black men. And these young men don't see a way. They can't find a place to be somebody, to maintain a sense of dignity and worth. So when I look at that, I realize that that's post-traumatic slave syndrome. So what I'm saying to you is that the injury of slavery was transgenerationally transmitted, right? Because we learn it. We learn it. It's knee-jerk. We figure it out. And every generation, we give it to them. Because we pass on everything to the children, right? And the children begin to live out those things. And it's unconscious. I realize that it's unconscious. But again, when I look at the brothers, I understand there's a very, very different thing going on. One of the symptoms of post-traumatic slave syndrome. Understand that now we're not talking about post-traumatic stress disorder because of the protracted nature of slavery. The fact that it went on for hundreds of years suggested that the end result ain't post-traumatic stress disorder.
Right.
The end result is post-traumatic slave syndrome.